Right now, I have a special guest. We have Chris Carter from C&C Healthcare Services. Welcome, Chris.
Welcome. Thank you. Thank you. Thank you for having me.
Oh, we are really excited to talk to you. Tell us, how did um, C&C Healthcare Services come to be?
Well, actually, my partner and I started this company back in 2018. And we wanted to try to reach out to the rural area. So we first started off with home health. So we started with home health, reaching out there to all the Fallon, Fernley, Hawthorne areas. And because just due to the fact that a lot of people could not get out there.
Right?
So home health was kind of troublesome. So we then switched it to doing primary care, mental health, and wound care. So with the primary care and the behavioral health, we were able to do telehealth services. So the reasons why we wanted to do that was so that we could be able to reach those peoples in the rural areas. Because as Fallon, Fernley, Urington, sometimes it takes a couple hours just to make it to a doctor's appointment. And that's a couple hours
Exactly.
there, a couple hours back. That's pretty much a whole work day. So we wanted to think of something to where we were able to give back to the community, but also trying to maintain the wellness aspect of it. So that's kind of why we wanted to start C&C Healthcare Services.
Wow, wow. That is so impressive because you're right. Those rural regions, I mean, they typically have to commute out of the area, like you said, at least 1 to 2 hours just to see a general practitioner or an urgent care specialist. So, wow, wow. I'm so impressed you are serving the needs of those communities. Now, tell
Thank
us
you.
about your vision, Chris.
Our vision was to, like I said before, trying to reach those people who just weren't able to get the good health care that they needed. So that's pretty much why we started C&C Healthcare Services, so that the people in the rural areas were able to see the doctors or the nurse practitioners or get the, behavioral health and wellness that they needed, that they most of the time would not be able to get without taking a couple of days off of work. And if it snows out there in Reno, like it does a lot during the wintertime, people really can't maneuver to get anywhere near to a doctor's office. So that's pretty much why, we have an office in Reno, but we also set up an office in Fernley, so it can kind of be the halfway point so that people don't always have to travel to Reno to, go to the doctor's office. So our vision was to try to put our office in selected areas so that people wouldn't have to travel as far to see a specialist or a nurse practitioner or doctor that they needed to see.
Well, let's expand on some of those services that you are offering. So, for instance, are you working with specialty doctors? You did also mention mental health. So, let's talk about some of those specialty services.
Right. We are a primary care service, so we have nurse practitioners that work along with us. On our behavioral health side, we also have CPCs, LCSWs that can talk to people about their mental health and their wellness. And we also have our wound care clinic nurse practitioners who will go out to the home for those who have severe wounds and who can't leave the home. Our nurses will go out there and tend to them as well.
Right. And I will say one of the things that I've done stories on in the past is truly making sure that those services to the rural communities. Hey, Chris, I'm going to have to let you go, but very quickly, how do our viewers find you?
So we will actually, you can give us a call at our number, which is 775-682-0020. And you can also see us on our website, which is C and with the A and D, chealthcareservices.com. Just send us an email or give us a call, and we will be there more to help you guys out.
All right, Chris, thank you so much for joining us. And I look forward to what you are going to be doing for those communities.
Hey, thank you. Thank you for having me. Have a wonderful day.